person has died from the coronavirus in Cook County, and a stay-at-home order will go into effect tomorrow at 5 p.m.
Illinois Department of Public Health also announced a second person in Winnebago County has tested positive for the virus. The Winnebago County Health Department is holding a news conference right now. Let's go there and listen into what's happening.
Our central city in the region, Tom Mcnamara. In the state of Illinois today, it was just reported by the governor's office, there was 585 cases of COVID-19, 163 cases reported in the last 24 hours. Today we heard from the governor regarding his stay-at-home order. It is important to note a couple things. Dr. Martell will certainly get into a little more detail, as will the mayor, but it's important to, I think, that we all hit on a couple of the same things here. Number one, if you've been following many of the restrictions that have been put forward over the last week, then there may not be as big of a change in terms of the things we all need, such as groceries, going to the pharmacy for medication, getting gas at the gas station, even taking your dog for a walk. And so those normal day-to-day activities we all need are still going to be the case going forward. There's absolutely no reason to hoard or to be concerned about that. So hoarding should not be an issue in this community. There is enough for everyone. Do not rush out and hoard food. That is absolutely not something you need to do for your family. The mayor of Aurora made an interesting point today when he addressed his community. He said that just because we have a pandemic that we're working through together, and we will work through this together, and come out the other side and be in a good place. We will. However, just because we have a pandemic does not mean we need to have an infodemic. The spread of inaccurate misinformation, even with good intention, regardless of good intention that many of us have on social media, what it does are a couple things. Number one, it adds anxiety to folks at home. Number two, it leads to diminishing the capacity of our public health and first responders and medical professionals, because then they have to pivot and address inaccurate information. So as we go forward, it is more important than ever that we all work together to rely on our professionals and to get our information from trusted sources. And again, I want to thank the media for really doing a good job over the last week or 10 days on making sure that what gets pushed through our TV and print publications is vetted information that is coming from trusted sources. When you talk about trusted sources, our local Winnebago County Health Department, trusted source. The IDPH, the state equivalent, and also the CDC at the national level is where the majority of public health information should be flowing. Please make a commitment to that. We do have a pandemic, but we do not need to have an infodemic. As we go forward, when we talk about winning, it's no different than the game of football or basketball. It comes down to basic blocking and tackling. So when we talk about basic fundamentals to being successful going forward, it's the same things you've heard over the last week. Stay calm, stay apart. You still need to respect social distancing. Stay put. The governor issued a stay-at-home order today, and we will be talking more about that. And of course, there's never been a better time to stay connected. Reach out to your neighbors, reach out to your friends and family on the phone and social media and all the different ways we can reach out to people without doing so in person. The basic blocking and tackling and fundamentals around washing your hands, keeping your space in front of you clean, not using other people's cell phones is a great example. These are all the basic things that we need to be more vigilant about than ever. If you have not taken this seriously to this point, we're asking you to do so for us today. One thing you're going to hear from Dr. Martell today is examples of young people not being immune to this issue. So there's two concerns with our young people, and we need their leadership more than ever. At the end of the day, when we look back, they are going to help lead this effort over the next few weeks. Young people can carry COVID-19 and give it to somebody who has a chronic illness or who is elderly and more at risk. But as you will hear today from Dr. Martell, younger people are not immune to COVID-19. There's been some discussion about economic impact and the economy. When we hear economic professionals say the following, they are agreeing with health professionals. The number one way at this point to minimize the long-term impact on our economy is to do everything we can going forward to minimize the spread of COVID-19. So that is an economic and business strategy as well as a public health strategy. I want to reiterate something we talked about yesterday, is that we have an obligation every other day and all other times. Our public safety folks, our first responders, our frontline workers, they have our back. It is now our turn it's our time to return the favor. We need to have their back. We need to come and stay aligned with the governor's order. We need to practice the basic blocking and tackling fundamentals around staying apart, washing our hands, and staying put, so that we help protect them. They still have to do their tough job every day, and we need to have their back. There has been some information that has come out from the Small Business Administration related to our small business owners. That is going to be a topic of great discussion as we go forward, but definitely go online and look for information on that. Our local chambers have pushed out information, and you will hear more on that if you're a small business owner. I also want to thank our Emergency Operations Center, which was activated about a week ago. The work being done by Molly Wren and her team. I stopped in there today, and we have a number of our first responders and a number of our community folks, along with Mallory, doing a great job planning and preparing. So want to thank them for their efforts, as we do want to thank our Winnebago County Health Department for their leadership as well. One thing that's come to our attention, and it's not surprising, but this is where we need all of our citizens to be aware. We have, out of 285,000 citizens, some of the best people of all the 102 counties in the state of Illinois. But there will be one or two who will try to take advantage of a situation. So be aware of scams, people calling your house, asking you for credit card or personal information in efforts to raise money for fighting COVID-19. Just be aware that although we have, I believe, the best county and the best community in the state and in the Midwest, there's always going to be that one or two, so just be on guard against that. I also want to take a minute before I turn things over to the mayor and Dr. Martell and just say why I personally, although I don't like it, although I don't want to be having this conversation, why I do stand in support of the governor's decision today. He is a Democrat, I'm a Republican. This is not a political issue. We need to rely on the experts. That is an economic development strategy and a business strategy, and at this point, more importantly, it is a public health strategy. The reason I agree with the decision, even though I do not like it, even though it is tough, is that I believe this, that my community is safer if the region around Rockford and Winnebago County is adhering to the same principles of mitigation of COVID-19 as we are. I think our community and our region is potentially more safe and will be more safe, and we will come out of this quicker if our entire state is in alignment with some of these principles. It will help us get to the other side of this faster. I do think it's important, and we need everybody's commitment to it. With that, I just would add that to reiterate, and I'd ask our news partners to even put this up on your screen or put it in the print media, the COVID-19 hotline for Winnebago County that can answer your questions related to, issues related to Winnebago County and the COVID-19. It is 815-319-6705, 815-319-6705. Again, I want to thank you for your patience and your commitment to working together as one team and one family on this. And next, I want to introduce somebody who has been a steadfast leader in this very difficult situation, Dr. Martell, who has done a very good job of sharing accurate, fact-based information with our community. And she has become, as has the health department, has always been a very trusted source for information. And so with that, I will turn things over to Dr. Martell. Sandy.
Let me know if that works. Once again, thank you for joining us. I cannot thank our community enough. Over the last 2 weeks, we've been preparing you. We've been talking to you about the strategies you can do as an individual, whether it was frequent hand washing, social distancing, staying home when you're sick. And now we're moved into some community mitigation strategies. We started with reducing group sizes and community gatherings of 25 or more. We dropped it down to 10 as we adhered to the governor's directive regarding restaurants and bars moving to, takeout services so we could reduce again the social gathering. And then we moved, to some of our personal services where we knew they could not adhere to the social distancing recommendation. So as we moved through this, we did this with the intent that we wanted to flatten that curve, that our goal was to have as few cases in Winnebago County as we could possibly have. Unfortunately, we continue to have cases. I'm here to tell you that we had, as of today, there are a total of 3 cases. So we received notice of 2 additional cases in Winnebago County. One individual in their 30s and another individual in their 40s. So similar to what you've been hearing, this is not just a disease of those at risk in the higher age range. They are both residents in the city of Rockford, and after today, we will not be having a conversation of where they reside in the city or the county, because now you know it's in our county. All of the cases that we have are suggestive of community transmission, meaning they did not have a risk factor when they presented, but they did present to a healthcare provider with signs and symptoms, and the healthcare provider took the necessary action to test them. So it's important to understand that this now is in our community. We are going to continue to, as we've said, as we now have the order to stay at home with the idea that we can flatten it even more. As you heard today from the governor, we heard that there were more than additional 163 cases throughout the state. We've heard now, as of yesterday, throughout the nation, it's in every state. And our goal now is to try and reduce those cases to as few as possible. And so these strategies now, this is a stronger community mitigation strategy. So from just simply limiting the size of gatherings, closing schools, closing certain types of businesses, and I shouldn't say closure, but suspending them until we can then get back to our routine. But now we're asking people, they need to stay home. We talked about staying put, and now we have the order from the governor to stay home. We really need to kind of work on this as a way so that our healthcare systems can begin and continue to treat those most at risk. We've had difficult conversations about how do we test as many people that need testing, how do we prepare for the next phase of individuals who might need care in our hospital systems, and how can our clinic systems and those around us support us. The Emergency Operations Center backs us up on all of these discussions and conversations about how do we move that forward, and we can't thank them enough as they prepared for how do we feed students during the school year that normally get their foods from our school system. So we understand how disruptive this is, but we've said from the get-go that if we could disrupt the transmission, we would take the disruptive means necessary. So to give a little background, I know we always talk about the numbers. So we talked about we have 3 positive cases in total in Winnebago County as of today. We have done 41 what we call persons under investigation. We have done 121 tests through the private laboratory for those systems that are reporting to us. Total of 3 positive. We've received 42 negative results from the systems, but we have 117 tests still pending. So we expect those to continue to come out over the next few days. We will continue to test individuals, but our healthcare systems want to remind all of you, they will prepare for you, but please call before you go in. Individuals with mild symptoms may be asked just to stay at home and not have a test. Others may be brought into the healthcare system so they can further evaluate and determine testing. But it becomes important to stay in communication. So that stay at home is really a directive for all of us so that we can make sure that our healthcare systems are able to respond and care for the most vulnerable. So again, thank you for getting the information out. Try and keep those rumors from spreading. about, I heard so-and-so, I heard this and that, because every single one of those requires investigation from the health department, and it takes us off critical activities. So for every case we have, we must interview not only the case, but all the contacts, and then track back and determine what is their risk. So your support and really stopping rumors as both reporters and as the community is extremely important. Please know that we're ready for you. We are responding in every capable way that we can, that our healthcare systems are preparing to respond and have been responding, that as the situation changes, we are changing our strategy so that we can best stop this spread of COVID-19. So with that, I would like to introduce Mayor Tom Mcnamara to provide the city perspective.
Thank you, Dr. Martell, and thank you, Chairman Haney. As I've said each press conference, I just want to thank you both for your leadership and collaboration. I think our city and our county is in good hands with both of you leading our communities. So Dr. Martell provided you some information that there's 2 new cases in the city of Rockford. Obviously one of those days that I was hoping would never come, but knew would come. Just want to those families that have been most directly impacted by this, I want them to know that my thoughts and prayers are with them and that you are in good hands. The city of Rockford has 3 phenomenal health systems with some of the best physicians quite honestly in the state. So you are in good hands. We will be praying and thinking about you, and I know it's not just me, but the entire city of Rockford. So the mark of a great city, a great state, a great country is always how people come together when we face tremendous challenges. As you know, today Governor Pritzker announced the state of Illinois would begin a shelter-in-place, a stay-at-home ordinance beginning Saturday, March 21st at 5 p.m. Businesses such as supermarkets, banks, healthcare facilities, public transportation, pharmacies, gas stations, and other similar services will remain open as they play a key role in our society. Medical experts have cautioned us for dating back several weeks ago now, that life was going to change dramatically for all of us. We've been waiting for this, we've been preparing for this, and now it's upon us. If you're watching or listening right now, please know that hundreds of talented men and women are working to keep our community safe and functioning as we enter the stay-at-home order. And I would just urge all citizens, as these amazing heroes of today are going to work, respect them by staying at home. Our men and women in the healthcare and our first responders on the front lines keep us safe and healthy. They are also responding to other cases and incidents that have nothing to do with COVID-19. On behalf of our entire city, I want to thank them and their dedicated families for their service. Please know the Rockford Police Department and the Rockford Fire Departments are prepared and willing to maintain services to all residents. The City of Rockford's Public Works Department will continue to operate the water utility and respond to critical infrastructure emergencies, including water main breaks. Other city departments are functioning with staff members who are working from home when possible. I'm urging all non-essential travel to be avoided. Homeless people are not subject to this order. However, we are working with local agencies and encouraging them to seek shelter. This has been a difficult time for our businesses and their employees, so I would just like to address a couple of things that we are doing to help ease some of those struggles. Today, I authorize restaurants and bars to sell packaged liquor at the curbside and by delivery, which should help provide an additional revenue stream for those businesses. And also effective immediately today, the city will defer collection of our food and beverage tax. And also effective today, our city will defer our collection of the hotel and motel tax. all open facilities are required to practice and enforce social distancing. So this will be a difficult time as we all need to take care of ourselves. We also need to take care of our neighbors. I would encourage all of our residents, get out, take walks, exercise, and take those walks with your pets. Just ensure that you stay 6 feet away from others, except those members of your own household. This is a historic and defining time for our great city. We have a solemn responsibility to protect our families, our friends, our neighbors, and slow the spread of this virus. We must remain home unless it's absolutely necessary to leave. To some, this may seem like an overreaction. Make no mistake, it is the right action to stop the spread of COVID-19. Aggressive action is needed right now to slow this spread. We all have the responsibility to all those that we care about to do the right thing right now, which is staying home. I'll just say, years from now, when historians take a look at the actions that the city of Rockford has taken, I really hope that they'll say, Rockford was ready. Rockford did the right thing. Its people stepped up, as we always have, and they met this challenge together. To all Rockfordians, we are going to make it through this. We will be stronger on the other side of this crisis, and our community will be better because of our collective actions to save lives. Thank you. And I'll bring Dr. Martell up to begin answering questions.
Questions? Are people able to still donate blood?
Dr. Martell.
At the present time, we consider it a critical infrastructure, so yes, they are able to donate blood, and the blood donation centers throughout the nation have really established and put in procedures in place to protect both the staff and the donors from COVID-19.
The Illinois Department of Public Health still says that there's 2 cases of Winnebago. Can you just confirm the totals just to make sure?
What we're learning is that as more of the private labs are getting into the system, they are releasing results after noon, which is when the state puts up their count. But remember, right now they're referring you back to the locals for more complete and accurate counts. So we expect results will come out on a kind of a timely basis throughout the day.
Dr. Martell, you mentioned a person in his or her 30s and a person in his or her 40s, both from Rockford.
Correct.
Are you're not specifying the gender of either?
No, we're not. We're
Mayor McNamara, can I ask you about how this crisis is impacting law enforcement, whether the Rockford Police Department will be increasing its manpower given the circumstances?
So, Ken, as you know, it's a good question. As you know, the city of Rockford actually increased our authorized force over the last couple of years since I've been in office, and at this time we're not looking to increase our force. We're really fortunate that we have Chief Dan O'Shea, who's already laid out an internal plan for our police operations. But to all Rockfordians, our police officers will still be out on the streets enforcing public safety and ensuring compliance. We hope it's not necessary, but we will do what we need to do to ensure compliance with the governor's executive order.
Mayor, since you're up there, will public transportation staying open, will that limit the amount of riders on buses?
So it's a great question. So yes, public transportation will remain open. I will tell you, Michael Stubby, I think, has done a great job, the director of Rockford Mass Transit District. They are making sure that they're sanitizing the bus far more frequently, obviously. They're making sure that they take a number of precautions. They're providing free fares during this time. Just one big reason is they don't want the hand-to-hand exchange or the drop box exchange, so they've taken a number of steps. There will be times that bus, due to the routes and due to people's details work and the nature of what's going on today, that there may be more than 10 people on that bus. But with that being said, we certainly hope for non-essential travel, people won't be utilizing Rockford public transportation. So we need to ensure that people are staying home as much as possible, which will also help RMTD reduce the number of riders on the bus.
One more thing for you, Mayor McNamara. I think a lot of people, we've already mentioned that, people who are already taking precautions, that the shelter in place doesn't change a lot for them. Can you by chance, or maybe Chairman Heaney or whether Dr. Martell is best to answer this, can we walk through exactly what the difference is from the precautions taken yesterday by closing close contact businesses? What's the difference from the precautions put in place yesterday to the precautions put in place today, Paul?
So I'll let Dr. Martell answer. Just briefly from the city standpoint is we have been providing recommendations over the last several days and weeks. This provides us, I state, just more authority to enforce those actions, but I'll let Dr. Martell address anything.
Well, I think you're talking from two different angles. One is the policy perspective. Now we have a regional approach. We typically try and work very much with our local health departments in our region. But, you know, you challenged me on some questions earlier last week why the numbers were different here. And so now this puts us all on the same playing field. I'm going to say that, you know, at this point. And it also really, it's the next level. It's not just, you know, I'm going to say social distancing and staying away from groups of 10. It now says stay put, stay home if you're not in an essential function.
Question for either the mayor or the chairman or both. The governor talks in terms of essential businesses, non-essential businesses. Are Rockford's manufacturing companies essential or non-essential?
We just received word today confirming the order, the stay-at-home order. And we will be getting that order, I'm sure, here in short order. And so, you know, yes, there will be, I'm sure, several, if not plenty of exceptions in manufacturing. There's been discussions around that. However, there's going to also be discussions about closing. And so to say that everything is definitive around manufacturing right at this time would be inaccurate. We need a little bit of time to actually get the order from the governor and have those conversations from there.
You might have a similar answer to this, but
yes, sir.
Off of what Kevin said, there are some businesses that are based out of state. Alorca comes to mind, that's right next to Rock Valley College. Do we have any idea whether or not that will be shut down or so on and so forth? Sure.
So, you know, my clear understanding of essential is just that. So you are going to see businesses that are essential to safety, essential to the overall supply chain. We are going to need a little bit of time on that. We are going to get the order, and we're going to look at that and also consult with the state and make sure we have a consistent approach. But let's back up for a second. At the end of the day, what we heard today was a stay-at-home order from the governor. What we are seeing is the next step, the next logical step towards mitigating the pandemic known as COVID-19. We want to have any conversations we need to have, but at the end of the day, we are going to work towards staying at home if at all possible, whenever possible, and to the degree possible. Absolutely, mitigating the spread of COVID-19 is the #1 priority. It is the #1 economic priority at this time, in this community, this region, this state, and this country is built around that. Is that what the discussion we want to be having? No, sir, it is not. But this is the reality that is in front of us, and we're dealing it with using science and data and relying on experts.
Dr. Martell?
Can I just add before So there's a big difference, Ken, obviously, between someone who is manufacturing sports equipment and someone who's maybe manufacturing masks that are needed for our first responders and healthcare providers. There's a big difference between logistics that will help our supply chain continue to move. So as Chairman Haney mentioned, we just listened to the governor provide this stay-at-home order, but we also we'll do what we've been doing, and I think what has made our response so effective, which is we take in the information and together we process that information. We together ask the questions that we believe needed to be asked to either the Illinois Department of Public Health or to the governor's office himself, and then we make that collective decision and then work hard to disseminate to all of you. So it being a Friday, fewer people in manufacturing will be set to go to work on Saturday. So we'll take that order beginning this afternoon, review it, process it, ask our questions, and then begin to disseminate it right away.
Mayor, actually, while you're there, yesterday, last night, Chicago closed their schools through a huge chunk of April. Has there been any further consideration on the school district on extending the date of closure? Anything you can tell us?
So I have not spoken with Dr. Aaron Jarrett today. My understanding from the governor's press conference, and we were working quite a bit through that time period, was that he kind of extended it indefinitely at this time. So Rockford Public Schools and all of our local private schools would obviously have to follow suit. But we will work to get you some more clarity on that because it's obviously so critical to all of our families, right?
Is there anything else you can tell us about the two new cases? Did they have any pre-existing conditions? Or I know that you haven't gone into specifics about gender, but what else can you tell us?
That's really protected health information. And remember, we're in a contact investigation at this point with their contacts. So at this point in time, we have to be really respectful that some of those people may be learning as we sit here, that they've been exposed and how we can best manage them, so we're not releasing any more personal details.
Yesterday, you walked us through a few other numbers as well.
Mm-hmm.
Do you have any update on how many negative cases we have, as well as how many are still pending?
Okay, so we'll go back through the numbers again, and I know we said we'd put a table out because we now are keeping numbers from those what we call PUIs. Those are people being authorized through the Illinois Department of Public Health because they've met the specific risk criteria. We have 41 of those, and we have 121 reported out to private laboratories. Now, that's a voluntary report to us as a health department, so there may be some others that we don't know about, but all of our healthcare systems have really committed to providing us with that information. Of all of the tests that have been submitted, we have 3 positive. We have 42 negative, but we have 117 pending, meaning the results have not yet come out. So if you were to look at that, right, you know, about 70%, 72% are still, results are still out. And of course, every day that number increases as we test more individuals. So, and again, you'll see the numbers in the PUI, and then you'll see the numbers in the private lab as well. But again, those are really to understand that testing takes, we've talked about that, we don't get the results in 24 hours, so even tests that are being done today may not result out till Monday, Tuesday of next week. And so we continue to work through that. And remember, the guidance from the Illinois Department of Public Health is they are prioritizing their testing system for individuals at the highest risk, meaning individuals who have been hospitalized with atypical pneumonia, that they really want to, again, take a look at skilled care facilities and those congregate living situations, if it's a homeless shelter, the justice system, or a long-term care facility. Those are being prioritized through that system, and the rest of the testing is going through what we call the private lab system.
3 positive, 42 negative, and how many pending?
117.
Thank you.
Mayor or Chairman Haney, do you know how this stay-at-home order will affect Amazon deliveries? Will that change at all?
It's our understanding at this time it will not change Amazon deliveries.
Well, I know we touched on,
Oh, in fact, just to follow that up, thank the mayor, they're in fact hiring more staff because of anticipation of the need to businesses increasing.
will our police force be at the essential businesses enforcing social distancing?
I would just say this, and I'll turn it over to the mayor, is every time that resources with first responders or the health department, for every minute spent on enforcement, it's a minute not spent on something else. And so what we're asking the community and what we're asking your viewers and your readers is, let's not diminish any of our capacity around first responders or any public health capacity because of lack of compliance. And I think it's in particular to our younger people. I know you're cooped up. I know you don't like it, and none of us do, but it is very important that we buy in, we are on the same team, because if we have to have our first responders investing time, it's time they're not spent doing something that, quite frankly, should be what they're focused on, and we need to allow them to focus on that. So we do need compliance so that we don't have to invest resources in that. I'll turn it over to the mayor.
So I'd say first and foremost, thus far, Rockfordians have really taken this seriously by and large. They were following the recommendation, so I have all the confidence that they will follow the executive orders of the governor. Enforcement will be one of the last things we would want to do. With that being said, I think there's been a lot of work being done behind the scenes. And before I get to the work behind the scenes, some of those enforcements, just because I know it'll be asked of me, is pulling permits, pulling licenses. No one wants to do that. That's absolutely the last thing we want to do. We want Rockfordians to step up to this challenge, as we always have, and follow the orders of stay at home for everyone's public health. But there's been a lot of really phenomenal work being done in the private sector right now with the help of government and private sector working together. One of those pieces of work is the Rockford Area Economic Development Council has been working with manufacturers and have also pulled in the Winnebago County Health Department so that they could develop protocols for safe and sanitized manufacturing to still continue. We have sent those protocols and procedures up the chain all the way up to the governor's office and to Brad Cole at the Illinois Municipal League to hopefully share those protocols with everyone else, because manufacturing isn't just critical for the city of Rockford, it's critical for the state of Illinois. And it's just one of those efforts that our community is doing to help ensure that as many businesses can continue to operate as possible, and that we're providing every assistance possible to these businesses in our community.
Mayor, the governor has been consistently telling people that not to hoard food.
Right.
Or that the grocery stores and the pharmacies will remain open. And yet, one of our photographers just uploaded a video to Twitter about over at Woodman's with just a jammed parking lot, lines of cars waiting to get into the parking lot because people are, I don't want to use the word panic, but people are swamping grocery stores.
Yeah. So it's a natural concern, right? It's a natural feeling. I understand it. I would just say, listen to those of us who have had those conversations with the supply chain, with the governor's office. There is no need to go out this second and buy significant bulk resources and hoard them at your home. I personally just haven't quite figured out the whole toilet paper concept myself, because no medical professional has ever told us that will help you. It's certainly not going to keep COVID-19 away from your house. So I would just echo those words. There is no reason to go out and hoard groceries in any way, shape, or form. The supply chain is strong. The only time that supply chain weakens is when people do go out and hoard large quantities. So I just urge, buy what you typically do. There won't be a day. It won't be on Saturday. It won't be on Sunday. It won't be on Monday. Every day, you'll have those grocery stores open. You'll have your pharmacy open. You'll have your gas stations open.
Mayor, really quickly, both of you can actually answer this. Concern with Rock County cases, the proximity, what are your thoughts? Anything you want to tell people that might be worried because it's so close?
So I don't know if anything will heighten our concern more than cases here at home, and then just looking statewide at these cases and how we've seen the exponential growth. So to me, I wouldn't say it has provided a heightened concern. I think all of us are monitoring this as closely as we already can be. But I'll let the chairman address it. Yes.
So in Wisconsin, there's actually a county called Winnebago County. And I know that because my daughter goes to UW Oshkosh. It's about 2.5 hours away. And they sent her home, but they wanted her to go Saturday to pick up the rest of her things in her dorm for the rest of the school year because they're only going to do e-learning now. We will not be making that trip. And I think backing up for a second, whether it's Rock County or it's any county in, outside of this region, one of the reasons we're we want to strongly, in the strongest terms possible, restrict travel is that it's unnecessary if our priority is what we say it is, and that is to flatten the curve, not to increase exposure. Back to the very good question about, lines at the grocery store. Let's go back to the fundamentals, the basic blocking and tackling that it's going to keep us safe and keep this COVID-19 from spreading. Maintain 6 feet of distance and avoid large crowds. You know what a long line tells me today? Number one, we know it's unnecessary. We are being very honest with you. One thing I'll say about Mayor McNamara and Dr. Martell and all of the people in the Emergency Operations Center, all of the people in the healthcare system, is they are being honest with you about the basic facts, not just the science, but when Mayor McNamara says he's not concerned about the food supply or the supply chain, that is based on what he's hearing. It's based on fact. So what it tells me that the line is a little longer today is people reacting to the news, as they often do. What it tells me is the line will be really short in about just a few days. But the food will still be there. Thank you.
I also want to point out that not only, is this not necessary, but you really endanger the people that are working in the store. Right, so if you're not respecting social distancing, if you're crowding up on those lines, the staff that are trying to stock the shelves, make sure the products get where they need to be, fill your prescriptions, you're putting them in harm's way, and we've decided that they are essential functions, right? We need groceries, we need medications. And I think that, some of our stores have done very creative to help some of that social distancing by having special hours for the senior population to come and, shop so that they are not in those crowded locations so that they can help that social distancing. But we really have to get real about this, right? It's not just in your, kind of work environments that we need 6 feet. It's for everyone. And so I really want to urge the community to understand that, not only are you protecting yourself, but you're protecting those critical infrastructure, whether it's law enforcement, the healthcare worker, the pharmacist, the grocery store bagger at the, Woodman's. It's time to really understand everything is being done to ensure the supply chain is intact at a national level, but we then have to do our own local kind of thing, which is keep that distancing, respect each other's space, and understand that everyone is working very hard to make sure that the community has everything it needs to really stay home and stay put, and that throughout this, they will have the supplies needed.
Will local restaurants still be able to operate with curbside delivery?
I'm getting my steps in. Yes, they will still continue to be able to do curbside pickup. And, as we've said, all those things that we put in place before, they will be able to continue to operate with those limitations. But still, please, we encourage people. This is an opportunity. Many of our businesses, as we know, from a public health standpoint, they are social determinants of health. We want a vibrant community. Please support them, but respect and maintain that. This is not the time to get a big line going and, as you wait for a sandwich. Step out, wait till it's your turn to get in, and they'll make you a sandwich and you can carry it out.
Any other questions? Thank you very much, guys. Appreciate your time.
And you've been listening to Dr. Martell with the Winnebago County Health Department. She did announce today 2 additional confirmed cases of COVID-19 in Winnebago County. 2 Rockford residents, one in their 30s and one in their 40s, and then the third previously reported is a man in his 60s. She did say there are also 117 pending cases the department's still waiting results for.
Both Dr. Martell and Board Chairman Frank Haney talked about spreading inaccurate information. Get it from reliable sources, they say, not your friend's Facebook page. Rumors are rumors, and then those rumors actually need to be investigated and take resources away from what could be legitimate cases. We also heard Dr. Martell say there at the end that basically restaurants will still be allowed to do curbside and drive-through pickup. Also advised, don't crowd grocery stores. We're not going to run out of food. A lot came out of that news conference. We will have a full recap of our local, state, and national developments when it comes to COVID-19 coming up in just a few minutes on Eyewitness News at 5. Hope you can join us then.